So, what exactly in your life got you to become a psychiatrist?
Well, that's a great question. Thank you. So, what got me to become a psychiatrist is that I was actually a born healer. I was born into a family in a fair amount of chaos and disarray, and I was like called. I hit the time card upon arrival. My job was to bring love and affinity to a family in chaos and disarray. You see, I had two older brothers, 10 and 14 years older than me, and they were with my parents. And you can imagine I had two angry adolescent brothers with my parents. So when I arrived, I was actually there to bring peace and joy and love to that family. As I went through life, I became very enchanted with the whole idea of communication, and I could tell that when I felt heard, or when I heard another person, when I actually listened, I saw the magic of that. And I went through school hoping that I would learn how to communicate while I was in school, but of course that never happened. School is not a place for open discourse. So instead, I talked a lot. I was, there's no teacher that had me in elementary school who's forgotten having Fred, for sure. And then, I thought, how do these big kids learn how to communicate anyways? Maybe it's junior high, and it got worse in junior high. Then it got even worse in high school. And then I decided I'd just go to college. That's where the peace marches were. That's where people knew how to communicate. And I thought I would just go to college, and that would be where I communicated. So because I had such great helmets, and they were only 40 miles away, I went to the University of Michigan. I didn't like the university. It was sort of the same thing, the same exact problem, where communication was not what was being emphasized. So I dropped out, and I came all the way to California to, find out what I was about. And I had a good summer there, but eventually I heard about this new industry that is coming out, this new profession that was now, being made available. And my brothers and parents thought that I would be really good at it. And you might have heard of the profession. It was actually called computers. And there was one computer in the University of Michigan that was like a 2-acre facility. And I decided to come back to the University of Michigan and be a computer science guy. So I spent like day and night in this computer room. It's like a 2-acre facility just with computers. But I didn't like batch jobs and punch cards and all of that. So Fortran and COBOL, and no, it just wasn't going to work. So I dropped out a second time. And here's where I learned how to be, what I wanted to learn my whole life, which was my mom told me I needed to get a job. So, moms will be that way. They got me an application, and I started working at a state mental health facility for adolescent boys, helping them actually get their stuff back together, and the way that I would do that would be through communication. So this was the first time that I was actually being reimbursed or remunerated for communicating with others. But it was also the first time that I was being paid to heal people through communication. I didn't like the way that psychiatry was going. I already knew that. I could feel that psychiatry was going through a significant shift that was moving towards medication and diagnoses. I absolutely hated that whole idea, and that's why I went into the field, was so that I could bring communication and connection to that field that was heading south. So I eventually made my decision that I wasn't going to stay a child care worker my life. I'll go back to school third time, finish my undergraduate degree, go to medical school, get a residency, go to psychiatry, get a child and adolescent fellowship. Lo and behold, that's what happened for those 10 years. And I graduated from Northwestern University as a psychiatrist, really hoping that I could make the change that I thought I was going to make with communication and connection. In the meantime, the field had shifted drastically. There was a new paradigm shift because Prozac had been initiated. Prozac was a super big drug in 1987. It was on the cover of Newsweek all by itself, the cover of Time all by itself, just the capsule. And the idea was that it was the new panacea. If you were uncomfortable, it meant there was something wrong with you, which is totally absurd. That's like blaming a log for burning in a fire. But nevertheless, that's what I did, and I kept to, because there was so much sunken costs, and because I had a new job and it was high-powered, and lots of prestige, and top of the world, I'm a doctor. I started doing what I was going to do, which I kind of lived two lives. On the one hand, I was diagnosing and medicating people on demand, and on the other hand, I was letting you know, don't do that. It's not making you better. That's what eventually led me to be a psychiatrist. That's how my practice started.
Nice. Okay. I like that. What's the best aspect and what's the greatest challenge?
So the best aspect of being a psychiatrist is that, I really get to help people. People come to me with the whole idea of trust, know, trust, and like me at some level so that they can share their lives and their troubles, their trials and tribulations, whatever imbalances that they're feeling or whatever discomfort that they're feeling, even if they're miserable. And they come to me hoping that I can actually help them out of their rabbit hole, help them out of their sinkhole. I love being counted on. I love meeting new people. I love communicating. And although that's become less and less a formal part of what psychiatry is about, they don't even teach psychotherapy in psychiatric residency anymore. They do not expect psychiatrists to do very much talking with the therapist, with the patients. They expect us to diagnose and treat. You're going to do talk therapy. You're going to do it with all the other specialties in the mental health field. Maybe psychologists, social workers, nurse practitioners, counselors or physician's assistants or something like this. But by the time they actually prove to be unhelpful to the patient, they punt it up to psychiatry for the big guns, hoping that we can then confirm the diagnosis, give them medications, and go from there. So that's the thing I like about it. But here's the thing I don't like about it. Those diagnoses and medicines, they don't work. Not only do they not work, they make the patient worse. There's a significant trauma in receiving a diagnosis. The idea is that once you have a diagnosis, that's how you see yourself as. So once you get a bipolar diagnosis, you're like, whatever you thought bipolar was, that's what you're now going to become. So now I'm bipolar, or I have ADHD, or I have autistic spectrum disorder, I'm a narcissist, I have anxiety disorder, I have social anxiety, I have post-traumatic stress disorder, I have schizoaffective disorder. Dude, what if you don't have any of those things? And then when I give you the medications, which were designed in these wild toxic laboratories actually, I had noticed over time that the medications actually induced, increased, perpetuated, or sometimes actually caused the symptoms that they were marketed to treat. Now this is a fantastic business model, but very frustrating for doctors who are interested in getting people better. People don't get better in psychiatry. The best you can hope for is to contain it. The theory is you have a condition, it's going to get worse, but we're going to slow down how worse it gets by giving you medicine. It's not going to get worse and worse. That's not really the truth. That's not really the nature of a mood or a discomfort. It actually goes back and forth, and we all know that. But when we say we have a condition, we pigeonhole ourselves into that condition and all the symptoms we think that are associated with that. Why do people do that? Well, some people really appreciate their diagnosis, and some people really love their therapy and love their treatment plan and even love their medications and would even choose never to change it for any reason. Like they think it's the saving of their life. And for those people, for the purpose of this conversation, I have to say, more power to you. If you have gotten that in any area of life where you're at the end of the road and you're like, I wouldn't change this for anything, man, what a great place to be. And you should just stay there. But this conversation is more for the hundreds of millions of people who actually know or feel that they've been misdiagnosed or underdiagnosed or overdiagnosed or mistreated, undertreated, overtreated, and they know they're getting worse and they're not getting the best case scenario. So the hard thing is that the gold standard is to diagnose and then treat. That's what the status quo is. But when I do that, I'm always concerned that I'm making them, not only keeping them normal like a Band-Aid, but more like a Band-Aid with a razor blade embedded in it, which is actually making them worse. Now you might know, and most people know this, that one of the things in the Hippocratic Oath, we raise our right hand and we say, first do no harm. And here, I am not positive that I'm not doing harm by diagnosing and medicating people. So I've had this real split attitude about it. On the one hand, I'm doing it. On the other hand, I'm not aligned with doing it. And it's caused a significant amount of death by 1,000 cuts or, soul sacrifice and heart pain and heartache. And that's the most difficult aspect of it, is that the modus operandi of the actual field is to diagnose and then treat. But my goodness, it's like I'm giving things to patients that are going to make them worse, and I'm sanctioning them, and my signature is on the invitation. You know, I write a prescription, my signature is on that invitation that says, I agree you should take this. It's like, I really don't agree, you really shouldn't take this, and I'm doing it anyways, and it causes, you know, that's for sure the hardest part is the duplicity that I've had to live in these 36 years.
I might imagine. What's the method?
The Moss method. Let me tell you about the Moss method.
The Moss method?
Yeah, so the Moss method is a non-medicating approach. There are 20 things listed in the Moss method, and it's a non-medication approach. It's not based at all that there's something wrong with you. Like maybe there's nothing wrong with you. So that the Moss method is actually utilizable by people who think they have a psychiatric condition just as well as by people who think they don't have a psychiatric condition. And it includes 20 things. I can name a few of them. Like we have gratitude lists before you wake up in the morning. We have, you know, getting outside in the morning and appreciating the divine infinity of life. We have meditation, we have nutrition, we have hydration, we have creativity, we have journaling, we have sleep hygiene, we have, you know, pampering, we have spirituality and, you know, being of service, among many other things. You know, I like cold showers, that's on that list, and you know, just ways to get ourselves optimized without having to go through some confirmation that there's something wrong with you and then giving you an actual labeled diagnosis which lives on, and then giving you a medication or some sort of treatment that actually perpetuates that condition. It's literally insane. And I cannot really appreciate that. So the Moss method is an alternative way, a non-medicating way to help everyone optimize their life, as long as people can get that maybe there's nothing inherently wrong with them. They can do the Moss method and make significant gains. This idea of your discomfort is going to be with you the rest of your life or going to recur because you have a condition is absurd. And the Moss method takes advantage of that by giving people all sorts of practices and exercises and tools that they can use to advance their life without the traumas of having to put toxins into their body as a way of managing discomfort.
Gotcha. What's the doctor?
The Undoctor.
The Undoctor.
Yeah, let me tell you a little bit about the Undoctor. So, over the years, as you can hear, I have developed kind of an attitude that I'd rather not give you a diagnosis at all. I just, your diagnosis is your name. That's it. Like my diagnosis, I do have one. It's called Fred Moss. I've lived a Fred Moss life, and I have whatever Fred Moss has learned and acquired and not learned and not acquired and been and not been, said and not said, done and not done. All those things lead me to be me, and I have my vulnerabilities, my sensitivities, my weaknesses, my strengths, my, place in the world, my interactive skills that are either, optimized or not effective, ineffective. And all those things come with being me. Now you have your own diagnosis, and we all have our own diagnosis. It's called you, and it's called humanity. So what the Undoctor was a moniker that I got from a friend of mine while I was at a men's retreat. And the Undoctor represents undiagnosing people, actually taking away the diagnosis they've been walking around in the world with, unmedicating people, taking away the medications that are perpetuating, inducing, increasing, or causing the symptoms they're marketed to treat. So undiagnosing, unmedicated, and finally, undoctrinating people. Undoctrinating is a word, of course, that I made up, and it's the opposite of indoctrination, meaning taking people entirely out of the psychiatric system so that they can live their life from a knowledge of realizing that even their discomforts, even their pains, their miseries, their trauma responses, their all of their all of their imbalances are part of them being human. Like, it's hard to be human. Have you noticed? It's a little bit hard to be human. It's completely okay that it's hard to be human. We are fighting demons all day long. If I had to ask you, how long would it take us to come up with 100 reasons to be depressed? I don't know, 4 minutes? If we took a break halfway through, it'd be like 4 minutes. How about anxious? About the same amount of time. How about terrified? Maybe 4 minutes. How about awkward? How about distracted? How about, in any way uncomfortable? We say we're hearing voices or that they are hearing voices. Actually, we're all hearing voices. Have you noticed? You call it intuition, or you call it you have a premonition. But in fact, when another person comes into the emergency room and says, I'm hearing voices, they get smacked with a psychiatric diagnosis, and frequently will go up to the hospital in that, in that facility, and they'll get treated with medications, which I've already discussed, actually create those symptoms. So now they can say, oh, now I really do have these. I'm glad I caught this before I came here because, this is what's helping me. But in truth, it doesn't help at all. It totally helps them deteriorate slowly, and often brings on what is called side effects, but they're really just effects. They're predictable effects of these toxic medications, which actually cause such significant problems, not only in psychiatry, but in other areas of our body and soul as well. So almost never these days is someone on one medication for a long time. Instead, doctors are taught that if they're on a medication and they continue to get worse, there's only 3 things we can do. We can add medication, we can increase medication, or we can change medication. But no one makes that very simple leap to realize, hello, the medicines themselves have a razor blade in the Band-Aid. The medicines themselves are making people worse. Doctors aren't even trained on how to take people off of medicine. And when I finally did it in 2006 to a big group of hundreds of people in my practice, what I learned was exactly what I'm saying. Most of the times the symptoms were immediately relieved, and predictably and reliably people got better, way better, such that their diagnosis actually disappeared. This was a fascinating finding, and I just wanted to tell everybody. I wanted to go to the mountaintops and just scream it to my doctor friends and to my parents of kids and to my patients and to my colleagues, like, we need to stop doing what we're doing. But screaming violently from the top of a mountain doesn't really get the job done. So I had to learn how to water it down, which I've done since 2006, so that I can actually communicate it calmly and realize that there's like no wrong players here. The way the system is built is so freaking beautiful. Everyone thinks they're doing what they're doing for the right reasons. And these are great people in the health field. And for the most part, people really want to help. But it's not individually that's causing the problem. It's the whole conglomerate working together that is creating, no one to really aim at, because people are just doing their job. But in the process of doing their jobs, the patients or the clients, the customers, the participants, are actually getting worse, and they don't have to. So, when the UnDoctor really gets going, what I'm really interested in doing is moving people who are possibly interested in coming into the mental health field, meeting them at the door and letting them know, you don't need to come in here. There's better. It's like guarding the guardrails. It's like guarding the revolving door into the system. If I can help people actually choose to do, or to do any number of things that are internationally well known through evidence-based, I can actually help people get better and even relieve their symptoms to the point that their perceived diagnosis disappears. So being the UnDoctor is really a great name that I got from my friend. And the cool thing about it is you don't have to be a doctor to be an UnDoctor. You see, if you and I had a discussion and you thought I was on medications, you could actually say to me, well, Fred, you really don't need medicines. And you could be convincing with me such that you could help me heal by coming off of medicines and by relieving myself of the diagnosis. It doesn't take a doctor to take someone off of medicine. It only takes the client. And the client themselves is almost always, like the ones who have already crossed the threshold and are taking medicines, they're pretty sure that there's something wrong with them. That's the whole big deal. I've looked, where is the entryway to this crazy cycle? And the entryway to this cycle is that patients come into my office certain that there's something wrong with them and they want me to fix that. But, you know, in most doctors, that's not how it goes. You go to the doctor to find out if there's something wrong with you. Not in psychiatry. In psychiatry, you go to the doctor to find out what's wrong with you, because it's the only subspecialty in all of medicine that if I tell somebody that they're okay, they get pissed. It's lunacy, dude. It's like crazy lunacy. Why should I be punished, or why should anyone like reject the idea that maybe they're okay? One of the things that a diagnosis allows for is it allows for us to relieve ourselves of the responsibility of a life that we're not proud of. Have you done things that you wish you wouldn't have done? Have you said things you wish you wouldn't have said? Have you hurt people inadvertently and sometimes intentionally? Yeah, you have. And then you might regret it later. But if you have a diagnosis hanging around, you have this luxury of saying, honey, that wasn't me, that was my ADHD. That wasn't me, that was my bipolar disorder. That wasn't me, I got PTSD, dude. I got social phobia. In some ways, you're blaming something that doesn't even exist and relieving yourself, relinquishing responsibility for your own actions and the way your life is going. So in this manner, what we're really talking about is helping people see that maybe there's nothing wrong with them. Because if there was nothing wrong with them, there'd be nothing to fix. They could just like realize, wow, I feel like crap. Welcome to humanity, which is the name of my brand. Yeah, you feel like crap? I get it. Yeah. Welcome to humanity is the name of my brand. Yeah.
That's awesome. That's awesome. Why do you want to leave the field?
Yeah, I think it becomes clear at this point, you know, the field doesn't work for me. The field causes a massive amount of headache and soul sacrifice. As you may have heard, you know, I had this pretty terrific medical condition in March of 2023 where I was working out and actually my aorta split. My aorta, leaving from my heart, actually split. A dissecting aortic aneurysm that I later presume was energetic more than anything. The idea that I've been living with a split heart for 35 years might have contributed to this exact physical injury, and I really believe that it has. It was almost like God and the spirits asking me, like, dude, get aligned with yourself. You don't get to live you don't get to hurt people and pretend that it's okay in order to keep the job or keep the prestige or keep the money. That is not what I'm here to do. I'm here to align with my greater soul. I'm here to align with my authentic, real, core, genuine self. When I do that, then maybe I don't have the same level of heart pain. Then I don't have the same level of soul sacrifice. Then I'm not causing so much damage or dis-ease with myself. And I can actually choose to be myself and to explore what really works for me. So in this manner, the dream of leaving this field so that I no longer have to like search down this rat-infested sinkhole of bullshit, like straight bullshit that's working backwards. The dream of leaving that field and finding a field for which I can actually stand for myself, be honest with myself, be genuine, authentic with others, and make a massive contribution in helping people as the born healer I was when I punched in on my birthday. That's something that really does work for me. So leaving the field is the only way that that's going to go. And I have to be really careful about podcasts like this as well, because this is agitating to just look backwards into the stuff and actually, like complain about it or call it wrong or say that I don't belong or say that it's corrupt or deceitful. There's some pain in doing that too. Maybe the right move, and I thought about that. I didn't sleep well last night. I was up since 2:30, and I was thinking maybe the real gift here is to no longer kick the dog. Like maybe I got nothing more to say about this field other than what I might say on a stage. But maybe I got nothing to say about my assessment of how the field is going or whether it's like worthwhile or adequate. And I can actually start looking forward-minded into how I can make a difference in areas of life that people can actually find their true self and can actually learn how to speak their true voice and make a real difference in the world.
I like that. I like what you're talking about. what's next for you, and what's something that you want everybody to take away from this conversation?
You know, what's next for me, I think, is this whole idea of being a keynote speaker. And really, I can be an inspirational speaker, as you hear here. I mean, people really like what I'm saying. What's so interesting about what I'm saying is it's not very controversial in the end. It may be different than the way some people are acting, but I haven't had people say, no, dude, medications are better than no medication. I've never had anyone say that. Not really. People know that medications are pretty sketchy at the very least. Pretty sketchy. And what do medications do? You know, what medications do more than anything is they're like remember the concept of a dirty bomb. You might be too young for it, but it's a bomb that kills way more things than the intended target. That's what these medicines actually do. So if you're anxious, and I give you a medicine that relieves you of anxiety, it's also relieving you of all feelings. All of a sudden, you can't feel anxiety. And if you stay focused on, am I anxious? You'll see, you know what? I'm less anxious than I was. What you don't realize is you're less everything than you were. Everything has been blanketed. Everything has been smothered. Everything has been diluted. And on top of that, like the anxiety medicines I just said, actually cause anxiety. If I want to give you a panic attack, all I have to do is start you on some anti-anxiety agents and wait a few weeks, and you'll have a panic attack. If I want to give you psychosis, all I have to do is give you an antipsychotic, and you'll start really having psychotic thinking. This is what these things do. They actually cause the symptoms, and they count on us flipping the horse in the cart. So what happens when you're taking these medicines, when you feel well in between, you think the medicines are helping you cause that. And when you feel poor, you think it's a relapse of yourself. What if it's the opposite? When you feel well, it's because the medications are not bothering you. And when you feel poor, it's because the medications are actually doing that which you're intended to do, which as a business model, perpetuating this whole mentality is extraordinary. There has never been a more profitable business model created in the history of planet Earth. I make that very clear. What I'm talking about is several $billion per day in profit margin from this particular industry. I don't know about you, but any company that's making several $billion per day in profit margin alone can't be legitimate. It's not even mathematically possible to be legitimate and have those numbers pan out. But people are pretty sure that it's helping, and it does have this quality that when you discontinue these medicines, you get a spike of the symptoms they're marketed to treat. That's also a great model, right? Because now I'm like, you know what? I don't want to take this crap anymore. I'm going to stop. I stop, and here comes depression from my antidepressant. Like all of a sudden I get a boost of a real feeling of depression. I'm like, oh, there's my condition back again. What I'm forgetting is that it's actually caused by me stopping the medicine. It's not a relapse or a return of the old symptoms. It's actually embedded in the discontinuation of medications that you get a spike of the symptoms it's marketed to treat. And with that, of course, you know, we have like a very deep problem in you know, how to proceed kindly, how to proceed worthwhile. And so what I'm really looking to do now is take the stage, and maybe there's other things that can really help people. There's the Moss method. Another thing I'm doing, that I'm pretty embedded, pretty committed to this as well, is helping people with financial literacy. One of the jobs one of the positions that I have is helping people learn that financial literacy, getting their money right, is a great pathway to the heart and soul. And when your money is right, when you actually are, you know, you've socked away maybe 10% of your income, and you know, it's building on the side, and you know, and maybe you've created multiple revenue streams, multi-handed income, then you can get a sense of mental health and mental awareness that you otherwise wouldn't have had. That works way better than anything that I've ever given as far as a medication. The other thing that of course works way better than medication and is by like eons more potent than any kind of medication treatment is human connection. Have you ever noticed that when someone really gets you, or you feel like you get someone, there's this thrill and a relief of healing, like a curing at that moment. You felt cruddy, you felt horrible, And then here comes somebody who can relate to that and actually contain you, actually be with you and get it, such that you believe that you're not alone, or at least somebody understands and hears and connects with you. And at that moment, without any side effects, without any need for authorization, without any co-pays, without any doctor's orders, you catapult to health when people can understand whatever your discomfort is about. So I think those are the things that I'm really aimed at, is making this possible from the stage, making this possible for more people than just one at a time, which the field is inundated with these one-on-one treatments, which don't help anyone, and they have to stay secret on top of that, so you can't even tell people what happened in there. It's ridiculous. And I don't want to do that anymore. I want to make a positive difference without slamming the profession that, let's face it, I've been a psychiatrist for 36 years, and I've been alive for only 67 of those. So I've been a psychiatrist, or I've been in the mental health field for 45 years, given that child care worker stuff I did for many years beforehand. And the time now is really to get that my future doesn't have to be dedicated to that field. My future can actually step forward and make a positive difference in the world. And that's what I'm committed to do in whatever way I can. And it's taking a transition and a mindset shift, a paradigmatic shift, for me to realize that that's the direction I really want to go in.
Nice. Lastly, if people want to know more about you,
yeah.
Call to action. If people wanting to know more about what you do, or maybe they're relating to this,
yeah.
and they want to seek for some help as far as
yeah.
what you're talking about, how can they reach out to you and find you?
Yeah, the best way to find me, of course, is at drfred360.com and drfred360.com. There you'll get access to everything that everything I create. All my books are there. All my freebies are there. I have, a couple great books. I have, I've been on over 200 podcasts as a guest. I've dropped 300 podcasts as a host. And, a lot of my writing is there. I have some award-winning articles that I've written. I've also written for Psychology Today. And a lot of my videos and a lot of my audios are there as well. So you get access to that. But the thing that's really important is the contact. What I would love to do is, have the people hit that contact list, and then hit text me. And then in that text button, just leave me your full name as well as your best email, and my office will get back to you that day, and we can set up a time to either talk, or I can direct you to where to go to meet your available needs. Now, the one thing I want to make really clear, if I had one thing to tell everybody who is going to go in this direction, the one thing I would say, and by now it should become obvious, is maybe, just maybe, there's nothing wrong with you. No kidding. Even if you're flippin' miserably uncomfortable, it's okay. Welcome to humanity.
Love it. Awesome.
Yeah.
That was good.
Thank you.
33 minutes.
Perfect, man.
Solid.
Very solid.